My name is Gareth Owens. I'm a patient advocate for the Think Aorta campaign, and I also sit as a patient representative on the Royal College of Surgeons of Edinburgh Patient Safety Group. And it's a great honour for me to be here as a patient this morning to speak to you at the invitation of the BGS Academy on acute aortic dissection surgery, a patient view. Imagine, if you will, that you are 11 years old. Take yourself back to that moment in time and think about where you are as an 11-year-old and who you are with. What's going on around you? What are your dreams and hopes for the future? And when you get there in your mind's eye, I want you to imagine that you are a very excited 11-year-old. And you're excited because it's almost Christmas. And on this particular day, 11-year-old you is shopping with Dad for Mum's Christmas present. You scour the town for the perfect present, and you find it and take it home with Dad, where you wrap it up in secret. And Dad says, I know the perfect place where we can hide this present so that Mum will not find it before Christmas Day. So together you hide the present, and you're so excited because you can't wait to see the look on Mum's face on Christmas morning when she unwraps this present that you and Dad have bought for her. You're so excited that actually you struggle to get to sleep that night. You're just imagining the excitement of Christmas morning, and you're so happy that you found the right present for Mum. But eventually you drift off. And you're woken up at about 3 o'clock in the morning by a terrible commotion going on in the house. Mum comes into your bedroom and says to you that Dad has been taken to hospital in an ambulance because he's had something that you've never heard of, called an aortic dissection. You're sent to stay with some neighbours while Mum goes to the hospital, and Dad is made comfortable at the hospital, and you visit him once or twice during that week. But he has a very serious acute aortic dissection, and in this particular district hospital in South Wales in 1976, there is nothing that can be done for him. And so, sadly, after a week, he passes away due to an aortic dissection that ruptures. And you bury Dad on Christmas Eve. On Christmas morning, although you and Mum never feel like celebrating Christmas ever again, you go to the place where you and Dad hid the present, and with tears streaming down your cheeks, you bring it out and give Mum her Christmas gift in a way and with a reaction that was not what you expected at all. After Christmas, you're surrounded by doctors who are examining you, GPs, cardiologists, and they tell you that Dad's aortic dissection was due to a genetic condition called Marfan syndrome, and that you, at 11 years old, have a risk of an aortic dissection because you have inherited Marfan syndrome from Dad. They tell you that if ever you get ripping, tearing chest pain, you must go straight to A&E because you might be having an aortic dissection. They tell you that according to the literature, your life expectancy at this point is 32 plus or minus 16 years. And so as an 11-year-old with the weight of responsibility for mum falling on your shoulders and this newly acquired knowledge about Marfan syndrome and your risk of aortic dissection, you have to work out a strategy for your life. From the very lowest point in your life to date, you have to work out how to rebuild and how to get on with your life and what it's going to look like. And you do that. And you do that, and you get yourself an education that you think would make Dad proud. You meet someone, and you get married, and you start a family. You have a successful career, and life is good. But at every major decision point in your life, this Marfan syndrome and risk of an acute aortic dissection is hanging over you like a sword of Damocles, poised to fall when you least expect it. Eventually, after a very long time, at around the same age Dad was when he had his aortic dissection, you're enjoying a drink with some friends in a pub when it happens. You're struck by exactly the same aortic dissection at the same age as Dad was. But your good fortune is that from the paramedics who pick you up from the floor of the pub to the emergency department team and everybody involved in that acute pathway, they all know how to think aorta. And so because the team knows to think aorta, you are very quickly taken to resus. You very quickly given the right intravenous drugs to lower your blood pressure, to deal with your pain. And you're very quickly put into a CT scanner to see what is going on with your aorta. What the clinicians find out is that you have an acute, complicated type B aortic dissection. There's a large aneurysm just distal to the left subclavian artery. You can see it there in the top right-hand side of the chest. And a dissection flap that extends all the way down the descending thoracic aorta, past the bifurcation and into the iliac arteries. So quite an extensive type B aortic dissection. You meet the on-call consultant vascular surgeon in the A&E department who comes and tells you about this aortic dissection. Imagine with that history and at that acute moment in your life, how you might feel. Might you feel frightened? Maybe not, because remember, you know about aortic dissection from Dad's death, and you've been expecting this for almost 40 years. Might you feel angry that despite 30 years of annual cardiology appointments and echocardiography of your aorta, all that was ever visualized was the ascending aorta on the left there, and nobody spotted the growing aneurysm in your descending thoracic aorta that eventually led to your aortic dissection. Only a CT scan or an MRI could have shown that, and you were never offered one. But maybe in this acute moment, there isn't time for fear, and there isn't time for anger. Maybe you feel something else, and it's at this point that I don't need to imagine, because this is my story, how I came to survive an acute aortic dissection. And I met the on-call consultant vascular surgeon at the Royal London Hospital, Mr. Sandip Sarkar. And he drew me this diagram. I hadn't seen the scans. So he drew me this diagram to explain what was going on with my aorta. And I said, you know, doctor, this is history repeating itself. My dad had this. He was taken to hospital in an ambulance. He died a few days later. I said, be honest with me, Mr. Sarkar. I've got a few days, have I? Because I was certain that this was the end. And Sandip, to his credit, said, maybe. He said, you are critically ill. You have a very serious condition. But if you can get through the next few days, we can do things that we couldn't do when your dad died. Surgery has advanced very significantly, and we now have techniques that enable us to repair dissected aortas. It's very major surgery, but what I think will happen, he said, is that I will send you to Bart's Heart Centre, which is just across in the city, and the cardiothoracic surgeons will replace your descending thoracic aorta, where the aneurysm is, and where the entry tear is. And if you survive that and make a good recovery, then you can come back here to the Royal London. And I and my colleague, Mr. Flora, will support you through a repair of your abdominal aorta and iliac arteries. And you know, it was very early days, and it was still a very acute situation. But what Sandip did in that very short bedside conversation was transform my mindset. I had expected that I would die of an aortic dissection before the age of 50, like Dad did, because I had inherited his Marfan syndrome. And Sandip gave me hope that that needn't be the outcome. And this little diagram, which I still have, represents that conversation by my bed when I was given hope. So I'd say to you as clinicians, never underestimate the power that is yours to give the patient hope, even in the most dire of situations. Because this conversation turned my mindset around, and I thought, if there is hope that I can survive, then that's what I'm going to do. And my journey from that point on became the journey of survival. Sure enough, I was blue lighted to Bart's Heart Centre, where I benefited from a staged replacement of the aorta. The aortic MDT at Bart's discussed the case. The type B dissection was managed into a subacute state. And first I had a descending thoracic aortic repair with Professor Rakesh Uppal and Mr. John Yap. And then after I recovered from that, about a year later, my abdominal aneurysm had grown to 6 centimeters. So the dissectional flap went all the way through it. So I had an abdominal repair with Mr. Flora and Mr. Sarkar. And so I have dacron grafts from Terumo aortic top and bottom. And you can see here in the photo some members of the Bart's aorta team demonstrating how they repaired my aorta in stages. And the benefit of that is that they didn't have to touch the sort of suprarenal area in the middle, which is where there would have been quite a significant risk of paraplegia. And if that ever needs addressing in the future, now I have data on top and bottom, then I would be a candidate for some endovascular solution that would lam into the existing data on grafts and repair the suprarenal aorta. But at the moment, it's quite stable. So I very much owe my life to Mr. Sacher, who diagnosed my dissection, and to the Bart's aortic team, who devised and implemented this surgical strategy and gave me a great outcome from an acute aortic dissection against my expectations. And they say that I'm a very good advocate for what they do there. So this is a picture that just encapsulates my aortic dissection journey from a businessman in the city one morning to the same day in resus at the Royal London, to recovering from the cardiothoracic surgery at Bart's Heart Centre, and recovering in the Royal London ICU from the abdominal aortic surgery, and then in a hammock at one of our aortic dissection buddies' garden parties about 3 months post-op, when I started to meet with other aortic dissection survivors. We connected on Facebook and started talking, and then we decided we'd get together. And first time I'd met another aortic dissection survivor, and we talked about the fact that we were a very exclusive group of people who'd had the care necessary to survive acute aortic dissection. And we realized for the first time that we were a very, very lucky minority, and that most people don't get the experience that we had. Most people who have an aortic dissection lose their lives to the condition. And while we can't save everybody, quite often the people who lose their lives do so because of delayed diagnosis and transfer and an inability to access the gold standard care that I was fortunate enough to benefit from at Bart's. So we became quite agitated about this, and we decided that it was time that somebody raised awareness of aortic dissection, and somebody campaigned to ensure that everybody in this country who has an aortic dissection can benefit from modern medicine and surgery, the advances in medicine and surgery that have happened since my dad died, that now enable aortic dissection survivors to have good outcomes. So we set up what became the national patient charity, Aortic Dissection Awareness UK and Ireland, and we set up the Think Aorta campaign, which focuses on diagnosis of dissection in the acute setting, getting more patients to the operating theatre to receive life-saving surgery. The Think Aorta campaign uses real patient case studies like mine and others to promote awareness and education of the difference that it can make when we think aorta and do the right thing. We use contrasting stories like the story of Andrew Stevenson, another 50-year-old man who had a type A dissection while out for a bike ride and went to the hospital in Lincoln, where sadly he didn't receive a CT scan, and he was discharged in a wheelchair with a diagnosis of overexertion, and tragically died the following day from his acute type A aortic dissection. And Andrew's parents are part of the Think Aorta campaign, who go around the Midlands telling his story to raise awareness and ensure that positive outcomes are the result of Andrew's tragic death. And we contrast stories like Andrew's, and there are many, with stories like my friend Anne Cotton, who also had an acute type A aortic dissection at the age of 50, and due to prompt diagnosis and transfer to a specialist aortic centre, had life-saving surgery, and over a number of years had 3 surgeries to replace her entire aorta from root to iliacs with Terumo aortic dacron grafts. So she's a great advertisement for Terumo aortic, and has a completely dacron aorta. An amazing lady who has recovered well enough from that experience that she recently took over from me as chair of the National Patient Charity Aortic Dissection Awareness UK and Ireland. And I wish her every success in that role with what is now a well-established national patient charity for this condition. So Think Aorta is about saving lives, and it's also about bringing you, if you're a cardiac surgeon or a vascular surgeon in particular, bringing you more acute dissection cases that you can work your life-saving magic on. One of the responses to the campaign in 2020 was from the government's Healthcare Safety Investigation Branch. They published this report, which identified delayed recognition of aortic dissection as a national patient safety issue. And in response to that, the Royal College of Emergency Medicine and the Royal College of Radiologists produced their first ever joint best practice guideline. So we now have national guidance from 2 Royal Colleges on how to diagnose thoracic aortic dissection in the emergency department. You can download that from either of the college's websites or from the Think Aorta website, actually. Then we worked with a group of vascular surgeons led by Professor Rob Hinchcliffe at Bristol to develop a consensus around the transfer of acute aortic dissection patients, how best to look after them during transfer from where they had the dissection to a specialist aortic centre. And we published that as the Traversing study. So there is now a national consensus on transfer. And then as a result of a lot of work that's been going on nationally, recently we endorsed this super regional SOP on the acute management of aortic dissections that's been produced by a multidisciplinary team in the southeast and southwest regions. So for a region of 15 million people, the team produced this SOP to improve acute management of dissections and to expedite diagnosis and transfer of dissection patients to the specialist aortic centres in the southeast and southwest. And very grateful to some of the surgical leads in the region for doing that. If you want an SOP on acute dissection for your region or for your trust, start with this and save yourself a lot of work. It really is an excellent document that is endorsed by the National Patient Charity. Does it work? It does. The evidence is now coming through. Last year I was in Edinburgh and I saw this presentation on how acute type A dissection cases have grown from the 2008 to 2014 era to the 2015 to 2022 era by 127%. Now, correlation is not causation, but it's no coincidence that during that period we have been running a national high-profile Think Aorta awareness campaign in acute aortic dissection, and it's good to see more people making it to theatre, 127% of people making it to theatre and having surgery for their acute aortic dissections. We look at the national picture. This is the National Adult Cardiac Surgery Audit, which in 2023 reported that more patients are receiving emergency aortic surgery and noted that over 9 years, there was a 68% increase in cases. So that's about 250 lives a year being saved through better access to the kind of life-saving aortic surgery that I was fortunate enough to receive. And the latest NACSA report updates that to 82% increase in cases over 10 years. That's about 315 people a year. But what's significant here is the auditors found and put in the narrative that this is not related to an increase in prevalence of the disease, but it was related most likely to publicity campaigns such as Think Aorta, raising awareness of the diagnosis. And it said it seems likely these have been successful in raising the number of cases. So Think Aorta is creating more cases for specialist aortic surgeons. So it's good to see that we have fellowship programs and we're training more people in aortic surgery. It's the only area of cardiac surgery where cases are growing rather than falling. actually. And it warms my heart to see the impact I think aorta is having on patient access to life-saving surgery. If you haven't seen Think Aorta before, it's now become a global patient-led movement. Every country around the world has the same issue of poor diagnosis and transfer in acute aortic dissection. So the life-saving Think Aorta poster is now available in the native language of 50% of the world's population, and we're working on the other half. And we have active campaigns on 4 continents. And one of my colleagues, Rob Glass, leads our country implementations, and he's based in New York and is currently working on about another 10 countries who've asked to launch the Think Aorta campaign in their country and in their language. So Think Aorta is a truly global initiative at this point. It's endorsed by all of these professional societies, delighted at the number of surgical societies that endorse Think Aorta, and that gives the message incredible clinical credibility and enables us also to use the networks of these organizations to disseminate the campaign. I mentioned that Think Aorta is a campaign of the national patient charity, Aortic Dissection Awareness UK and Ireland. The charity does other things. We support patients and families who have been affected by aortic dissection. What we found was that as we started to grow our community of aortic dissection survivors, and in the UK we have about 1,500 aortic dissection survivors in the community now, patients told us that they left hospital having survived an aortic dissection, and really there wasn't any information about what to do or how to go on and live their lives, because for the first time in history, with your help as surgeons, we are creating a community of aortic dissection survivors. So we produced this, Aortic Dissection, the Patient Guide. It's endorsed by the Society for Cardiothoracic Surgery, the Vascular Society, and the Intensive Care Society. And it's a 96-page free handbook, everything you need to know if you've had an aortic dissection, and it's written by patients, for patients, although I do know that some clinicians give it to junior doctors to teach them about aortic dissection, and that's fine too. So this is a free of charge resource. You can order it on the charity's website, and within a couple of weeks, our partner Terumo Aortic will deliver you a box of patient guides that you can give to your dissection patients. So do avail yourself of that if you would like to. We produce a thoracic aortic aneurysm leaflet similarly. We produce a bereavement guide for families who are bereaved by aortic dissection, because the thing to remember is, even now, with the increase in people surviving aortic dissection, bereaved families still outnumber survivor families 3 to 1. So we have a huge constituency of bereaved families that we provide support to. How do they deal with an inquest? What about family genetic testing? Whole set of issues that families need to negotiate, often with very little support. So our bereavement guide is a resource, and we also have a bereavement group where bereaved families can talk to each other, and a bereavement support lead who spends a lot of time talking to newly bereaved families and helping them navigate the system and their grief. So we support anybody affected by aortic dissection. The lady in the middle is the wonderful Emma Hope. She is the charity's aortic specialist nurse. She runs a virtual clinic for us 1 day a week that anybody can go to who wants to talk about their aortic disease. She has a series of 45-minute appointments, so you can have a proper in-depth conversation about aortic disease, about recovery, about genetics, about any aspect of mental health, any aspect of the aortic dissection journey. Emma invented the concept of aortic specialist nursing at Southampton 10 years ago, and has been much loved by all of the Southampton patients who are in the charity. So when she retired from the NHS, it was a natural progression for us to ask her to join us as our aortic specialist nurse. And she does a great deal of good work with patients and also supporting NHS aortic specialist nurses around the country in the work that they do within the NHS, and helping centres make the business case for aortic specialist nurses. We're big fans of aortic specialist nursing, so if you would like to do that, then contact us and we're very happy to support you. The final thing that the charity does is enabling research. A few years ago, I went to speak with the Secretary of State for Health about aortic dissection, and I guess the headline that grabbed his attention was that aortic dissection currently kills more people in this country than road traffic accidents. And I spoke to him and I said, how much does your government spend on road safety? And how does that compare with what you're investing in aortic dissection? And as a result of that, he agreed to fund some aortic dissection research. We held a workshop at the Department of Health to identify the research priorities, national research priorities for aortic dissection, and he set aside some money in NIHR to fund aortic dissection research. Two big programs have been funded to date. In vascular surgery, the EARNEST program, which is looking at what is the right intervention for uncomplicated type B aortic dissection. Is it medical management or is it endovascular intervention? EARNEST is looking at that, and that's been funded by NIHR. And then in cardiac surgery, there's this program, the DECIDE TAD program, which is about screening for non-syndromic aortic disease, and can we increase the uptake of families accessing genetic screening as a way of preventing aortic dissection. So this is a partnership between the National Patient Charity and the University of Leicester, a number of other partners you'll see up there, funded by NIHR. It's a 5-year program, and it runs alongside the charity's Think Aorta, Think Family campaign, which is about preventing aortic dissection. And we think this will lead to more screening, to more discovery of thoracic aortic disease, and therefore to more elective surgery. So we're currently increasing emergency surgery. We think this will increase elective surgery and allow us to prevent dissections. So those are the things the National Patient Charity does. I'd encourage you to get involved. As surgeons, this is going to impact you. It's incredibly interesting, and as you will know, aortic dissection is a huge professional challenge for even the most experienced surgeon. And so we like to think of ourselves as working in partnership with you to help move forward the field and to improve care across the aortic dissection patient pathway. That really brings me to the end of the few words that I wanted to say to you. And I want to leave you with this Think Aorta message. What can you do as surgeons or as clinicians to help the campaign? I think we really value your partnership in spreading the word that great outcomes like mine are now possible in acute aortic dissection. It isn't an automatic death sentence. And we need to change the old thinking, and we need to promote that if you think aorta and you make the diagnosis with a CT scan, you give patients the chance of a great outcome. And the faster we get them to surgery, the better that outcome is likely to be. So please share the campaign. Tell somebody that you've watched this video. Promote Think Aorta in your emergency departments, to your cardiology colleagues, so that they are well aware of it and able to act appropriately when they see an aortic dissection patient. We as a patient charity are going places. The Think Aorta campaign is going places, and we invite you to join us on our journey and to share our vision, really, which is that over the next 20 years, we want to turn aortic dissection from a cardiovascular catastrophe into a preventable disease. Thank you very much for your attention.